Our Sinew channel, the hand Taiyang, small intestine meridian, begins on the dorsum of the little finger, posterior surface of the little finger, binds at the wrist, moves up the ulnar side of the forearm to the elbow, moves up the arm to bind at the axilla, travels behind the axilla and surrounds the scapula, moves up the neck, just in front of the bladder channel, sinew, sinew channel, binds at the mastoid process, moves behind the ear, where a branch enters the ear, continues to move up behind the ear, moves slightly above the ear, and then descends and binds at the mandible, so the mastoid process and the mandible. And then it ascends across the teeth to bind at the outer corner of the eye, and then at stomach 8, that way. So starts on the posterior aspect of the little finger, moves up the ulnar side of the hand, the ulnar side of the forearm, posterior aspect of the upper arm, crossing and surrounding the shoulder blade, moving up the neck just anterior to the urinary bladder sinew channel, behind the ear where it binds at the mastoid process, a branch enters the ear, then moves up around the ear, binds at the mandible, and then crosses the teeth, binds at the outer canthus of the eye, the outer corner, and connects again at stomach 8, head corner, that way. Pathological symptoms of the small intestine channel can be a strained little finger, pain along the medial aspect of the elbow and upper arm, pain below the axilla on the posterior part of the axilla, pain of the scapula that radiates to the neck, tinnitus, T-I-N-N-I-T-U-S, which is ringing in the ear, pain of the ear that may reach the submandibular region, or the area around and under the mandible, a need to close the eyes for a long period of time before being able to see clearly, and tension of the neck that leads to swelling of the neck. We see here a picture of the Luo channel. It separates from the small intestine channel at small intestine 7 and connects with the heart channel, then moves up along the arm and connects with the shoulder at large intestine 15. So we have a connection with this channel, right? Really a lot of shoulder issues, see, around the whole scapula, a connection of the primary channel to the large intestine channel, large intestine 14, and a connection of the connecting channel, large intestine 15. Our points of the small intestine channel of hand Taiyang, entry point is small intestine 1. Our exit point is small intestine 19. Small intestine 19 to urinary bladder 1 is the exit branch. Our Shi cleft point is small intestine 6. Our Yuan source point, small intestine 4. Jing River, small intestine 1, associated with metal. Ying Springs, small intestine 2, associated with water. Shu Stream is small intestine 3, associated with wood. Jing Well, small intestine 5, associated with fire, our Harari point. He, small intestine 8, is our earth point on the fire channel of hand Taiyang. Luo point is small intestine 7. The front mu is Ren 4, conception vessel 4. The back shu, urinary bladder 27. Small intestine 1, Schautze, lesser marsh. This is our Jingwell point, metal point, and entry point on the small intestine channel of hand Taiyang. It's on the ulnar side of the little finger, about 1/10 of a sun proximal to the corner of the nail. Actions: expels wind heat, subdues wind, opens the orifices, removes obstructions from the channels, and promotes lactation. Indications: headache, febrile disease, loss of consciousness, insufficient lactation, which is production of breast milk, sore throat, redness of the eye, cloudiness of the cornea. I think when we talk about points of the small intestine channel being used for disorders of the breast, or in this case, insufficient lactation, we must look at the pathway of the primary channel, which passes through the conception vessel in the center of the chest and connects with Ren 17, which is considered one of the command points of qi in the chest. So it opens up the qi through the chest, and thereby we can say it opens the flow of breast milk. And that could be one explanation as to why this point has an effect on insufficient lactation, as do other points of the channel. Small intestine 1, small intestine 2, small intestine 11, all have an effect on lactation and disorders of the chest. And I suppose it could be ascribed to the pathway, or it definitely can be ascribed to the pathway of the channel. Here we see small intestine 1, next to heart 9, yes. Exit point on the heart channel, a little exit branch here, and then the entry point on the small intestine channel. Small intestine 3, Hushi, back ravine. This is the shoestring point, wood point, as such is a tonification point, wood on fire. The master point of the dumai, the governor vessel. When a loose fist is made, the point is on the ulnar side of the distal palmar crease, proximal to the 5th metacarpal phalangeal joint, at the end of the transverse crease at the junction of the red and white skin, or where the skin changes color. So if you make a very loose fist, you'll see right near the knuckle, the MCP joint, on the ulnar side, there's a crease. Right at the end of that crease, and it should be just proximal to the joint. At the junction where the skin changes color, there's small intestine 3, Hushi. Actions: eliminates interior wind from the dumai, expels exterior wind, benefits the sinews, resolves dampness and jaundice, clears the mind. Indicated in pain and rigidity of the neck. You can see that's bolded, right? So the indications that are bolded are the primary uses for this point. Pain and rigidity of the neck, febrile disease, contracture and numbness of the fingers, which can be ascribed to wind. Okay. We also say tinnitus, deafness, sore throat, mania, malaria, acute lumbar sprain, its connection to the dew, right, the governor vessel which runs through the spine, night sweating, pain in the elbow and shoulder, and that can be ascribed to the pathway of the channel. Great point to know. This is another big point, and one that I think that you'll find very, very useful in practice because it does quite a bit, and it is good at what it does. Febrile disease, contracture, numbness of the fingers, pain and rigidity of the neck. Can be used as an adjunct point for tinnitus, which is ringing in the ear, lumbar sprain, deafness, sore throat, mania, malaria, night sweats, pain in the elbow and shoulder. I have the privilege to introduce a guest lecturer, so pay close attention as we discuss small intestine 6.
Small intestine 6. Yang Lao, nourishing the old, she cleft point, location. Dorsal to the head of the ulna. When the palm faces the chest, the point is in the bony cleft on the radial side of the styloid process. Action. Benefits the sinew, brightens the eyes, removes obstruction from the channel. Indication. Blurring of vision, pain in the shoulder, elbow, and arm.
Thank you very much, Professor. So when we talk about the point being on the radial side of the styloid process of the ulna, right here's the styloid process of the radius, and we know that lung 7 is here, right? Small intestine 1, 2, 3, right here, right? 6 is just here in the cleft on the radial side of the styloid process of the ulna. Radial side of the styloid process of the ulna. The point is called nourishing the old or supporting the aged. And according to Ellis and Weissman in Grasping the Wind, they talk about joints being affected as one gets older. Often the wrist joints are affected with stiffness and pain. Not only is small intestine 6 a good point for joint pain of the wrist, but it also can be used for lower back pain, shoulder pain, poor eyesight, and deafness. So for this reason, it's called supporting the aged or nourishing the old, right? It's helpful for some of the ailments that come with aging, such as sore wrists, elbows, shoulders, diminished hearing, diminished eyesight. Small intestine 8, Xiaohai. Xiaohai, small intestine C. This is the Hussey point. I think the reason for the name is self-explanatory. This is an earth point on the fire channel, so a sedation point. When the elbow is flexed, the point is located in the depression between the olecranon of the ulna and the medial epicondyle of the humerus. Bend your elbow, find your olecranon, run your finger superior and slightly medial, and boom, there's a depression right there. Right? And you can feel the epicondyle, the medial epicondyle of the humerus and the olecranon. In that depression, small intestine 8, Xiaohai. The point actions, resolves damp heat, removes obstruction from the channel, and calms the mind. Headache, swelling of the cheek, pain in the nape or the back of the neck, pain in the shoulder, arm, and elbow, or epilepsy. These are indications for small intestine 8. Headache, swelling of the cheek, pain in the nape of the neck, shoulder, arm, and elbow, or epilepsy.